Hello, my name is Shannon Donner, and I am doing my presentation on central auditory processing disorder known as CAPD. Disorder because some professionals decided that they did not need the central at the beginning of the name. Other professionals put it in. So, what is central auditory processing disorder? According to the American Speech Language Hearing Association, CAPD is the difficulty processing auditory information in people who have normal peripheral hearing. It includes difficulty in locating the source and direction of sound, discriminating between sounds, identifying patterns of sound, discerning sounds and background noise. Medically speaking, humans have a peripheral auditory system. The peripheral auditory system converts sound into neural signals, meaning it is your initial intake of sound through your ear canals. Vestibulocochlear nerve to the central auditory system. The central auditory system processes the neural signals and converts them into auditory sensations before transmitting them to the auditory cortex to be processed. With CAPD, the information does not get processed correctly in the auditory cortex, so students' information gets lost and jumbled here. As you can see in this diagram, I have the auditory nerve in the central auditory nervous system circled because that is where the information does get lost. So what does this mean? It's trouble processing information. Students hear things and they don't understand what they're saying. They sit there and they go, well, what do I do with what I heard? It doesn't make any sense, which leads to difficulty comprehending, which is where some of the reading struggles come from. There are many symptoms and characteristics of CAPD, including poor listening skills, being distracted by external or irrelevant noise, difficulty hearing when there's background noise, difficulty locating sound, following directions, and paying attention in school. Students may have a history of ear infections, but they don't always have that history. And it can include academic struggles, particularly in reading and spelling, because students have a problem identifying the different sounds of the letters and the words, which leads to their difficulty spelling. CAPD is frequently misdiagnosed as attention deficit hyperactivity disorder, also known as ADHD. ADHD has the following symptoms: hyperactivity, disinhibition, forgetfulness, disorganization, distractedness, and inattention. Disorganization, distractedness, inattention, and forgetfulness are all also symptoms of CAPD. Students get distracted by different noises they hear, different sounds. They have trouble locating where those sounds are coming from. They have trouble paying attention in class because if you're not sure what's going on, you can't pay attention. They may forget the directions, primarily because they didn't understand the directions and they couldn't process those directions. How do we diagnose CAPD? An audiologist or a speech-language pathologist testing to the student. They call this the preliminary screening, where they gather different information through different assessments. They assess the student's cognitive function, their speech and language development, their peripheral hearing, how the initial sound, behavioral observations, how they behave in class, whether or not they're paying attention, if they're distracted, if they're falling asleep, and an audiological screening. If that preliminary test reveals that the child may have auditory processing disorder, he or she will go through a test battery. The test battery is completed because many professionals disagree on what should be included in that test battery. Currently, the test battery includes a dichotic listening skills test to tell whether or not the student can tell different sounds presented to both ears simultaneously. They test temporal ordering abilities, the sequencing of sounds, their binaural interactions, whether or not their ears can function together, or a speech-in, noise, and low-pass filtered speech test to identify whether or not the child has the ability to identify a target speaker from surrounding noise. And when I think about this, I think about when I run centers in my classroom. I think about the child that, though he's sitting right in front of me, is too busy looking around and trying to figure out what's going on in the other groups. And when I think about that, I think, well, this child could possibly have CAPD because they're so busy focusing on the other sounds in the room at the different centers, they're not hearing what I'm saying right in front of them. There is a way to manage CAPD. However, there is no research to treatment at this time. Each child's auditory profile is different, therefore they would be treated and managed differently. It has been some success with interactive metronome therapy. These students and children cope with auditory processing disorder and improve concentration. This picture of this cute little boy is currently using interactive metronome therapy, and I have a link to a video that explains a little bit more about it.
Being successful in school definitely requires concentration.
But for some students, that's because they suffer from what's called an auditory processing disorder. Health specialist Marilyn Mitchell shows us what it is and what can be done about it in Doc Talk. Like most seventh graders, Ben Gomez hates doing homework. Concentrating in school is also tough.
He's not getting the information in, so it's making sense.
Ben was diagnosed borderline ADD and given medication, but it didn't work and made him sick. Further studies revealed Ben has something called auditory processing disorder, a condition where his brain doesn't interpret words or sounds correctly.
It's hard to for.
The cause is unclear, but we know these kids have no intelligent poor grades because of trouble concentrating. Pediatric physical therapist Grace Bracken recommended interactive metronome to help Ben. IM uses a timing device that you must listen to and practice certain exercises.
It develops motor pathways in his brain that helps him to coordinate both sides of his body.
Watch as Ben must clap in sync with the sound in the headphones. A second tone then tells him if he's on time, early, or late. So far, so good.
Things are getting in his processing and his routine.
Ben's also off the medication that made him sick.
By the end, he was about 4 years higher grade level. So it really made a big difference.
He's back in the game, is doing better in school, and doesn't even mind homework anymore.
Maybe if I keep going, I'll get better at what I've gotten better at.
Interactive metronome can also be used to treat brain injuries from cerebral palsy or stroke. It also has been proven to be successful for anyone that wants to improve their coordination, including professional athletes. I'm Marilyn Mitchell. If you got a serious medical problem, see your doctor.
So that was a little bit of information about interactive metronome therapy. There are also other treatments available to students with CAPD. Other modifications and recommendations made for students with CAPD include decreasing background noise, improving the room's acoustics by covering hard floors and walls. I know in a classroom this can be difficult to make your walls and your floor softer, but maybe if you were to have a student in your class with CAPD, you could ask for carpeting in your room, which might decrease the unnecessary noise some of these students might hear. You could give your child preferential seating, meaning that they're not by the door, they're not by the window, they're front and center in the room closest to your voice, to hopefully help assist them in their processing. You can make sure they understand what you're talking about, monitor their understanding by checking in with them frequently, asking if they have any questions, asking if they didn't understand anything, and rephrasing if they do need additional help. You can use several learning modalities such as tactile learning, visual learning, and auditory learning. Tactile and visual should be used in conjunction with auditory learning. Tactile meaning they have different manipulatives. They can touch what they're learning. Visual, using videos or PowerPoints to help them follow along. You can use organizers for new information and vocabulary, so things are broken down a little more easily for your students. Students who have CAPD should be given notes from the lecture as opposed to just having to sit down and recopy or take ferocious notes while they're being lectured to. That can be very distracting to students, and they're going to have a hard time following what's being said in the lecture. So by providing those notes, it'll help them follow along much more easily. You can repeat, repeat, repeat. Repeat everything you say, especially if it's something that you know is a little more difficult to grasp. Say it a different way, rephrase it to help them be more successful. In summary, CAPD is a central auditory processing disorder that prevents students from processing and hearing. A test can be administered by an audiologist to determine if the child has this disorder, and it is often misdiagnosed as ADHD. Students can be treated with environmental changes, recommendations made by the teacher. Thank you very much for listening to my presentation. I hope you learned a little bit more about CAPD, and I hope you have a wonderful day.